Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. You can also visit my playlist. In the playlist, I have provided almost all the topics in a very systematic order. So that will going to help in study. My dear friends, today we will have another topic for discussion. Another very important disease which is mentioned in Kaumarbhartya, especially related to Ayurveda pediatrics, is Parigarbhika. So everybody might have been heard this name, disease by name Parigarbhika. This is one of the very important disease. Of course, this disease is mentioned basically by Ashtanga Sangraha. In Ashtanga Sangraha, Uttara Tantra, second chapter, there is explanation of this disease. Meanwhile, even in Madhava Nidana Balaroga Adhyaya also, there is mentioning of this disease Parigarbhika. Now, understanding this disease is very important to have a critical analysis of this disease. This is a shloka which is given in the context of Parigarbhika by Ashtanga Sangraha. So what he says is, Matuhu Kumaro Garbinyaha Stanyam Praya Pibannapihi Kasagnir Sada Vamadu or Vamathu Kasagni Sada Vamatu Tandra Karshya Aruchir Brahmai Yujjate Koshtaradhyacha Tamahu Parigarbhikam Rogam Paribhavakyam cha Yujjat Tatragni Deepanam. This is the 4-line shloka, and now we have to evaluate everything or critically analyze everything by the help of these 4-line shloka. By looking at this shloka, it is again very clear that he has included a lot of pathology, causative factors under these 4 lines. So each and every word or each and every line has to be critically analyzed to understand the basic understanding of this disease in the present day contemporary science. So let us try for the same. Now, Pibanti iti shabdaha apibannapi. So in the Tika, there is mentioning of some other drugs. So Matu Kumaro Garbinya Stanyam Praya Pibannapi. So there he says Pibannapi means it is apibannapi. This is given, clarification given. That means Prayaha Pibannapi. That means child is not taking the breast milk. It comes like this. Now, another is this disease is called as Parigarbhika. Why it is called as Parigarbhika? That also we have to see what is the derivation and what is the exact meaning. Now he says that Parigarbhika is also called as Ahindi iti loke. In the general practice, this Parigarbhika disease is also called as Ahindi. This disease is also called as Paribhava. This disease is also called as Paribhavakya. Okay, and this disease is also called as Dugdha Kitta. So these are all actually the synonyms of disease Parigarbhika. Now let us see. This is a special nutritional disorder explained in Ayurveda which highlights the development of malnutrition during the infancy period. Now we have another disease which is almost all sharing the same pathology, that is Balashosha, that already we have discussed. But when we explain the Balashosha, it is very clear that the disease is not pointing towards the infancy period. It may be after 1 year the child is going to developing this Balashosha etc. symptoms, because there he is not telling anything below 1 year of the life. But when Ashtanga Sangraha explains, because Balashosha is also explained by Ashtanga Sangraha and Parigarbhika is also explained by Ashtanga Sangraha, where Balashosha probably it is limited after 1 year, whereas Parigarbhika is limited up to 1 year. That means what are the different causes and pathology of development of malnutritional disorder during the infancy period will be highlighted by the Parigarbhika disease, whereas after the infancy, maybe in the toddler age group, so that was highlighted by the disease Balashosha. Now let us see. The disease is also called as Paribhava, or it is also called as Parigarbhika, Ahindi or Dugdha Kitta. What is the meaning of paribhava? Paribhava means humiliation. Child is humiliated or baby is humiliated. Okay, that is a type of exploitation. Humiliated. What is the meaning of paribhavakya? Condition which is associated with humiliation. Okay. Similarly, what is the meaning of dugdha kitta? Dugdha kitta means it is the waste portion of the dugdha. The virtual meaning, that means word wise if you go for it, dugdha kitta means it is the waste portion or malabhaga of the dugdha. This may be taken as condition due to an increased non-nutritious contents in the breast milk. We can take this meaning: if the infant is consuming a milk, breast milk, which is not rich in nutritious thing, rather it is rich in non-nutritious unwanted things. If the baby is continuously consuming such type of breast milk, that baby may develop malnutrition like condition in future, therefore might have been given this name dugdha kitta. Similarly, there is another condition is ahindi. Ahindi, the word meaning of ahindi is emaciated condition. So again, in case of malnutrition, we will have emaciated condition. Now again, all the synonyms has to be taken totally to understand some of the meaning. For example, this paribhava, a disease condition where the main symptom is always humiliation of the baby, which may be because of non-nutritious breast milk consumption for a continuous period, resulting in emaciated condition. So this may be a probable definition that we can derive for Parigarbhika depending upon the synonyms given here. Now, in case of Parigarbhika, the basic cause which is mentioned for Parigarbhika by both the authors, Madhava and as well as Ashtanga Sangraha, is Matu Kumaro Garbinyo Stanyam Praya Pabiddapi. Matu Kumaro Garbinya Stanyam Praya Pibannapi. This word actually, Pibannapi, whether this A is there, Pibannapi or Pibannapi, this was a confusion actually. For that actually the Tika has given Pibanti iti Shabdaha Pibannapi. So we have to take here as Pibannapi. But still in some of the books it is given as a Pibannapi. So that creates a confusion. Now this may be a grammatical mistake or may not be. Anything is possible. We will see that later. So first line is Matu Kumaro Garbinya Stanyam Praya Pibannapi. Now we need to understand this particular sentence. So this portion we will deal in the next class. Thank you very much.